A gastrointestinal or GI assessment is a comprehensive evaluation of the digestive system designed to identify any abnormalities or issues related to the stomach, intestines, and associated organs. Here's an outline of a typical GI assessment. History taking, chief complaint. Determine the primary reason for the visit. Ask about symptoms like abdominal pain, nausea, vomiting, diarrhea, constipation, bloating, or changes in appetite. History of present illness, onset, duration, and pattern of symptoms. Aggravating and relieving factors. Associated symptoms such as weight loss or fever. Past medical history, previous GI conditions like GERD, ulcers, or Crohn's disease. Surgeries such as appendectomy or cholecystectomy, chronic diseases like diabetes or liver disease, medications, current and recent medications including over-the-counter drugs and supplements, family history, GI conditions in family members like colorectal cancer or celiac disease, social history, dietary habits, alcohol consumption, smoking, drug use, and travel history for potential exposure to infectious agents, review of systems. Questions about symptoms related to other systems that might impact or be impacted by GI health, such as fatigue or jaundice. Physical examination, general appearance. Observe the patient's general condition, posture, and comfort level. Vital signs, temperature, pulse, blood pressure, respiratory rate, inspection. Look at the abdomen for contour, symmetry, and skin changes such as scars, striae, or distension. Auscultation. Listen to bowel sounds in all 4 quadrants. Note frequency, pitch, and quality of sounds. Percussion. Assess for tympany and dullness to determine the presence of gas or fluid. Percuss the liver and spleen for size. Palpation. Light palpation to assess for tenderness, guarding, or masses. Deep palpation to evaluate the underlying organs and identify any abnormal masses. Special tests such as rebound tenderness for peritonitis, Murphy's sign for cholecystitis. Diagnostic tests are a crucial part of the gastrointestinal assessment. These include a range of laboratory tests such as a complete blood count or CBC, liver function tests known as LFTs, electrolytes, and various stool tests that check for occult blood and pathogens. Depending on the suspected condition, imaging studies like an abdominal X-ray, ultrasound, Connecticut scan, and MRI might be recommended. Additionally, endoscopic procedures are essential tools. An upper endoscopy, or EGD, evaluates the esophagus, stomach, and duodenum, while a colonoscopy is used to assess the large intestine and distal small intestine. Documentation is key. It is essential to record all findings accurately and systematically. This includes both subjective information, such as the patient's reported symptoms, and objective findings, which are observed and measured data. From here, we formulate a differential diagnosis based on the assessment data. This leads to planning further diagnostic evaluations or treatment as needed. A thorough GI assessment not only helps in identifying the root cause of symptoms, but also informing an appropriate management plan to address the patient's needs.